JBN, we keep you informed. $54 million hotel bill for Cubans. Hotel accommodation for a large team of healthcare workers from Cuba has cost the country approximately $54.3 million. On March 16, the Ministry of Health and Wellness paid $13.6 million to Surrey Management Limited for the accommodation of Cuban nurses. It later paid the same company on March 20 a little more than $40.7 million for Cuban medical workers. At least 140 healthcare workers from Cuba arrived in March to boost Jamaica's capacity to contain and treat COVID-19, which has triggered a lockdown of incoming passenger traffic to the country's ports. The ministry also purchased 45 television sets in the sum of $1,680,490 for quarantine facilities. The Ministry of Local Government received emergency funding of $50 million for its coronavirus project and another $50 million for the COVID-19 cleanup program. Nearly $304 million was spent to acquire personal protective equipment for medical staff. The 4 regional health authorities, which have direct management and operational responsibility for the island's public hospitals and health centers, have also been provided with initial financial support of close to $750 million to boost their capacity to mount an effective response to the pandemic. At the same time, the University Hospital of the West Indies has also been provided with an initial $200 million to enhance its capacity to treat patients with COVID-19. It has cost $500 million to procure prescription drugs through the National Health Fund to ensure the effective treatment of individuals with COVID-19. $194,683,664 for the procurement of 32 ventilators that are vital for persons who may become critically ill, and more than $2 million as an initial payment for the procurement of COVID-19 test kits. The ministry revealed last week that it had $300 million left of its $2.8 billion COVID-19 budget. Jodian Ferron's doctor says he did not detect heart condition. Dr. Lloyd Golson, the doctor of Jodian Ferron, the 23-year-old mother who died after giving birth, says he did not detect any indications of his patient having a heart condition. The statement released by his lawyer today follows what the University Hospital of the West Indies deemed as premature disclosure of autopsy findings, which suggested that Ferron died from a heart failure. Ferron died at the University Hospital on April 24 after being transferred from the Spanish Town Hospital where she had delivered her first child. The full statement reads, "I have given a statement to the police in the presence of my attorney Heron Dale. I am indeed saddened and devastated at the passing of Jodian. It has been reported that the post-mortem revealed that Miss Ferron had a heart condition. She first came to me for antenatal care when she was 6 months pregnant. While providing antenatal care for her, I was not informed of nor did I detect on examination any indication of her having a heart condition. I am mindful of my duty to my patients, my profession, and the general public, and previously made comments to the media which might have been untimely. It is understandable that coronavirus has descended on us like a plague and is causing a tremendous amount of fear. It is important that those of us who are requested to assist those in a crisis or in need cannot fail to act or panic out of fear. My hope is that the exploration of this very unfortunate event will lead to needed changes to ensure that it never happens again." Portlanders face water woes amid COVID fears. The movement of people in Springbank, Portland, has been restricted as a result of the novel coronavirus COVID-19. But according to Claude Bobo Daly, by adhering to the restrictions, it is their way of staying safe. Daly explained that residents are observing the regulations and guidelines set by the Ministry of Health and Wellness by wearing face masks when they go out in the public space or by simply staying home. The Rastaman was also quick to point out that there is unease among Portlanders, with some even panicking since the emergence of COVID-19. We see people have their mask and them thing with them spray, But you can tell say them afraid, said Daly. You hardly see anybody on the street, and worse when it touch night. The time hot now and a man might stump on him veranda, but the road clean and it coming like a ghost town. From the touch 6 o'clock, yes, it coming like a jumby town. Everybody gone home. Daly admitted that he and other residents were deeply concerned after learning that a resident from their area tested positive for COVID-19 in March, which sent shockwaves throughout the community. Me ear said them find a case down the road. Me kinda scared and me still not trust them because them can still have it in a them and it not affect them, but it affect we. This are my little corners, but me not open it up. Cause they say the money transfer thing, me scared of them thing they see it. Me no want sell nothing, Daly added. The makeshift corner shop, which has been closed down since the onset of COVID-19, once offered to the public the opportunity to purchase soft drinks, bottled water, banana chips, biscuits, and bun and cheese, among other items. But while Daly is happy with the measures being practiced by residents, he bemoaned the absence of piped water in the community, which makes it challenging to engage in frequent hand washing and bathing. Another resident, Derek Myrie, showed an abandoned tank, which he said was the only source of water in the community, and spoke about the importance of preserving that water source. This is where we all have to come to catch water during the dry season, he said. People from all over, in Shatova, Lighthouse and Free School, come here to catch water. This source has never dried up, and I've been living here for more than 30 years. It has always been running. We also use this water for drinking purposes. The three communities named by Myrie are roughly 3 to 4 miles from that water source and is increasingly difficult to traverse due to the rugged terrain. Expectant mothers fearful after Ferron tragedy. A number of expectant mothers are expressing fear as their delivery dates draw nearer due to the tragic sequence of events which resulted in the death of 23-year-old first-time mom Jodian Ferron over a week ago. Ferron, who had visited the Andrews Memorial Hospital in St. Andrew to deliver a baby, reportedly presented with symptoms of COVID-19, which has caused a deadly coronavirus pandemic, triggering a frantic search for an appropriately equipped facility to take her. Hours after delivering her baby at the Spanish Town Hospital, she passed away at the University Hospital of the West Indies. Her COVID-19 test also came back negative, pointing to the breakdown in COVID-19 protocols for laboring patients. The expectant mothers have expressed fear that the health system could again fail another mother in distress. Speaking yesterday as she walked out of the Victoria Jubilee Hospital in Kingston, where she is expected to deliver her bundle of joy in May, Shanika Blair said she has been experiencing a dry cough for the past week and fears the worst if it does not go away by the time she is in labor. A dry cough is among the range of symptoms of the COVID-19 respiratory disease. I have a cough like a dry cough. That is the only thing that bothers me right now, because I am saying if I go there to have my baby, they might reject me. The cough is not because of coronavirus, but because I will drink cold things sometimes. I fear that because of this one dry cough, I could possibly lose my child or my life. I am due for May 24, and I'm really worried about what will happen if I don't get rid of the dry cough by then, she said. Further, the 22-year-old expectant mother shared that even though she does not believe that a health facility should reject a pregnant woman, regardless of the circumstances, she is mentally preparing for the worst because of Ferron's case. Another expectant mother, who is registered to deliver her baby at the University Hospital of the West Indies, said she is also worried and is hoping that better measures will be implemented to deal with the swirling virus. I am a bit fearful because of all that occurred with Jodian, so I'm thinking, will our health system fail for me or prevail? It is not as drastic for me as those expecting to deliver this week or next month, because I am due in October, but the fear still exists, Wadey Knight said. I think better measures and strategies should be put in place with the whole COVID-19 thing going around, because if you come out with a slight cough, that doesn't mean you have COVID. Obstetrician gynecologist Dr. Michael Abrams agreed that due to the recent event and the fear that might be engulfing pregnant women island-wide, the Ministry of Health should issue guidelines on how to deal with suspected cases of COVID-19 in laboring mothers. This is scary, and I think the ministry should issue guidelines to say If you're pregnant and laboring and have symptoms, this is where you go. This is very important because Jamaica has 14 parishes, so there cannot be just one place to go. If I was pregnant, I would be scared now, Abrahams said. There needs to be something that is rational and that everyone understands. Having symptoms, this is what I do. JBN, we keep you informed. Please remember to subscribe, like, share, leave us a comment and click the notification bell to receive our daily news items.